Hello, and welcome to this comprehensive training session on LL37, a human-derived antimicrobial peptide with broad-spectrum therapeutic applications. In this session, we will explore its mechanism of action, clinical applications, dosage protocols, risks, benefits, alternatives, and patient considerations. We will also review its potential in managing infections, inflammation, and chronic conditions, along with 3 detailed clinical case studies and recommended laboratory evaluations to ensure safe and effective use. Let's begin. LL37 is a naturally occurring antimicrobial peptide derived from cathelicidin, an immune defense molecule produced by epithelial cells, immune cells, and keratinocytes. It is the only human cathelicidin identified so far and plays a vital role in the innate immune system by combating bacterial, viral, and fungal pathogens. Beyond its antimicrobial properties, LL37 has demonstrated anti-inflammatory, wound healing, and immunomodulatory effects, making it a versatile therapeutic tool. While not FDA approved, LL37 is widely studied for its potential to manage resistant infections, chronic inflammatory conditions, and impaired wound healing. LL37 exerts its effects through several mechanisms. Antimicrobial activity, LL37 disrupts microbial membranes, leading to cell lysis and death. This activity targets a wide range of pathogens, including gram-positive and gram-negative bacteria, fungi, and viruses. Immunomodulation. LL37 regulates immune responses by modulating cytokine production, enhancing macrophage activity, and promoting anti-inflammatory pathways. Wound healing. LL37 stimulates angiogenesis, epithelialization, and tissue repair by attracting immune cells to injury sites and promoting collagen synthesis. Biofilm disruption. LL37 penetrates and breaks down biofilms, structures that shield pathogens from antibiotics and the immune system. These combined effects make LL37 a powerful therapeutic candidate for treating infections, chronic inflammation, and delayed wound healing. LL37 has demonstrated promise in several clinical areas. Chronic infections. Effective against antibiotic-resistant pathogens like methicillin-resistant Staphylococcus aureus, MRSA. Useful in managing chronic sinusitis, urinary tract infections, and respiratory infections. Wound healing. Accelerates healing in chronic wounds, diabetic ulcers, and burns. Autoimmune and inflammatory conditions. Modulates inflammation in conditions such as inflammatory bowel disease, IBD, psoriasis, and rheumatoid arthritis. Viral infections. Demonstrates antiviral activity against respiratory viruses including influenza and SARS-CoV-2. Cancer research. Investigated for its ability to suppress tumor growth by modulating the tumor microenvironment. Biofilm-related infections. Effective in breaking down biofilms in chronic infections such as dental and sinus infections. Benefits. The potential benefits of LL37 include broad-spectrum antimicrobial activity, effective against resistant pathogens, immunomodulatory effects that help balance pro-inflammatory and anti-inflammatory responses, accelerated wound healing and tissue repair, biofilm disruption, making infections more susceptible to immune responses and antibiotics, potential adjunctive therapy for antibiotic-resistant infections and chronic inflammatory diseases. Risks. While LL37 is generally well tolerated, potential risks include local injection site reactions, such as redness, swelling, or discomfort, transient flu-like symptoms, including mild fatigue or fever, theoretical risks of overactivation of the immune system, leading to excessive inflammation, limited long-term safety data due to its status as a research compound. Close monitoring and dose adjustments can mitigate these risks. Alternatives. Alternatives to LL37 for similar therapeutic goals include, for infections, conventional antibiotics, antifungal agents, or antiviral medications. For inflammation, immunomodulators like corticosteroids or biologics, for example, TNF inhibitors. For wound healing, growth factors, for example, platelet-derived growth factor, honey-based dressings, or hyperbaric oxygen therapy. For biofilm disruption, enzymatic debridement agents or adjunctive therapies like EDTA. LL37 is typically administered via subcutaneous or intravenous injection, depending on the clinical indication. For chronic infections, dose 50 to 100 micrograms per kilogram, administered subcutaneously daily or every other day for 2 to 4 weeks. For wound healing, dose 50 to 100 micrograms per kilogram, administered near the wound site daily or every other day until healing is achieved. For autoimmune or inflammatory conditions, dose 100 micrograms per kilogram, administered subcutaneously 2 to 3 times per week for 4 to 8 weeks. Treatment duration varies based on the condition but typically ranges from 2 to 8 weeks. Repeat cycles may be required for chronic or refractory conditions. Laboratory testing is essential to guide LL37 therapy and monitor its effects. Baseline testing, complete blood count, CBC, and comprehensive metabolic panel, CMP, inflammatory markers, C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, microbiological cultures or sensitivity tests for infections. Monitoring. During treatment, regular assessments of inflammatory markers to evaluate response, wound assessments using standardized wound healing metrics, post-treatment testing, repeat cultures to confirm eradication of infections, monitoring of inflammatory markers to ensure disease remission or control. Case study 1. Chronic wound healing in a diabetic patient. A 65-year-old male with type 2 diabetes presents with a chronic foot ulcer that has not healed despite standard wound care. Treatment protocol LL37, 50 micrograms per kilogram, administered subcutaneously near the wound site every other day for 4 weeks. Outcome: significant reduction in wound size and depth within 3 weeks. Complete healing achieved by week 6 with no signs of infection. Case study 2. Antibiotic-resistant sinus infection. A 40-year-old female with a history of chronic sinusitis caused by methicillin-resistant Staphylococcus aureus, MRSA, presents with recurrent symptoms despite multiple antibiotic courses. Treatment protocol LL37, 100 micrograms per kilogram, administered subcutaneously daily for 4 weeks. Outcome: resolution of sinus symptoms by week 3, nasal cultures confirmed eradication of MRSA. Case study 3. Inflammatory bowel disease, IBD. A 32-year-old male with ulcerative colitis presents with flare-ups and increased inflammatory markers despite corticosteroid therapy. Treatment protocol LL37, 100 micrograms per kilogram, administered subcutaneously 3 times per week for 8 weeks. Outcome: reduced inflammatory markers and significant symptom improvement within 4 weeks. The patient achieved remission by week 8. In conclusion, LL37 is a versatile peptide with significant potential in managing infections, inflammation, and chronic conditions. Its broad-spectrum antimicrobial activity, biofilm disruption, and wound healing properties make it a valuable adjunct in integrative medicine. While it is still a research compound, its safety profile and clinical benefits make it a promising therapeutic option for refractory infections, chronic inflammation, and delayed wound healing. Want to introduce peptide therapy to your patients? Get certified with our free course at freepeptidetraining.com.